So we'll see what happens there. But there was a bombshell dropped over the weekend in which ex-President Joe Biden was diagnosed with stage 4 metastatic cancer of the prostate. And for those men over the age of 45 or 50, this is a shock, because I had assumed that if you get your PSA done all the time, and that's an indicator, and DRE, digital rectal exam, you're kind of inoculated in a sense. So we all would like to know, as Americans, can we see the last 5 to 10 year history? When did the PSA spike? Did it happen during his presidency and he kept it secreted? He was the president until January of this year. And how bad a shape is it? So joining you and I now is Dr. Stephen Kappa. He's with the urology group here in Cincinnati. And Dr. Kappa, welcome, I think, for the first time to the Bill Cunningham Show. And this is something I'm sure you followed over the weekend. So just give us a general view as to the medical condition right now of ex-President Joe Biden.
Yeah, no, Bill, I'm thrilled to be here. Happy to, review the details of this case and really to emphasize to your listeners, to your men out there, the bottom line is it's important to get screened, to have these discussions about prostate cancer and prostate cancer prevention and screening early on, so you can hopefully avoid this unfortunate diagnosis that former President Biden received. So what we know, and this is just from his personal office release, is that he was diagnosed with an aggressive form of prostate cancer. They mentioned Gleason 9 disease or grade group 5 disease. They mentioned actually also that it presented with urinary symptoms, and we do see this sometimes. Prostate cancer is typically silent. It's, like you mentioned, diagnosed with PSA blood tests, but also sometimes with examination. The statement released indicated there was a prostate nodule. That's likely what started the biopsy process, which gives you the formal diagnosis. And, what is also unfortunate in his case, former President Biden's case, is it's metastasized or spread to the bone. I don't have many details beyond that. Again, we can go into more discussion about the specifics of men like him who present with aggressive disease. But that's what we know so far. I don't want to sugarcoat it. It's a very serious condition. But I also want to mention that for men, even like him, who are diagnosed with advanced prostate cancer, we have very good treatments that can focus on quality of life and slowing down the disease.
And Dr. Kappa, he's had cancerous polyps removed from his colon. He's had skin cancer. He's had stroke symptoms. He's elderly. One doc I saw today said that Biden has about a 30% chance of living 5 years from this point on. This is serious.
Yeah.
I guess, is that accurate, that if you catch it at this level in your early 80s, your time frame is quite limited?
Yeah, no, I mean, so for prostate cancer, it's the most common cancer in men. 1 in 8 men will get diagnosed with prostate cancer in their lifetime. It's the second most common killer in terms of cancer for men. But we fortunately find this in early stages, and men can actually do very well with appropriate treatment. So of all the men who are diagnosed with prostate cancer, only 3% will die from their disease. And your statistic there is absolutely true. So for men who present with advanced stage disease spread to other parts of the body, the 5-year survival is much lower at 37%, according to the most recent data. So, there's a big, wide spectrum in terms of how we treat and see these cases. But for the more advanced cases, it is more difficult, no doubt. But again, the emphasis will be is that he still has treatment options. I don't know the exact details of his case, but I do believe and trust he'll get excellent medical care from here.
Dr. Kappa, as far as releasing more information, I think it is required of a public official who was recently the president in January of this year to release to the public the last 5 or 10 years of PSA and DREs to see when this metastasized. Is it fair to say that this did not happen after January when he left office? This thing was present months or years before?
Well, typically, prostate cancer can be slow growing, and it's really hard for me to speculate on that. What we know is that his presentation was obstructive urinary symptoms, and that's what prompted the physical exam, the nodule, the workup, the biopsy, and the imaging that will ultimately, led to the information that we have available. We do see some cases where men have lower PSAs and have more aggressive forms of disease. PSA screening, as you mentioned, is a really important thing. And the recommendations now, and then this is just for all your listeners, at the age of 50, you got to get in, get your blood checked. It's a very simple blood draw and a physical exam for higher risk men, like black men, those who have a family history of prostate cancer. The recommendations are to get screened even earlier. Your question really was about, he's 82 years old. What are his PSAs for? Again, I don't have any information about that, unfortunately.
Well, the thought is, you hate to talk about politics when it's biology, but if he knew he had this cancer the last couple of years of his presidency, why wasn't that made public? Every time he had a yearly medical exam, the doctor said he was in tip-top shape. He could solve a Rubik's Cube in about 9 seconds, sharp as a tack. This guy's in great health. And I'm thinking, well, he's in great health, but he's stumbling, mumbling, and fumbling. And now he's got an aggressive form of prostate cancer that most certainly was present in the last 1 to 3 years of his presidency that we weren't notified of. What was this, a cover-up? And secondly, talk about the symptoms. Most men, tell me they get up once or twice a night. I know yours truly does, in order to urinate. What are the urinary symptoms that he had that would indicate that more aggressive treatment was indicated? What kind of symptoms are they?
Yeah, no, your point's a really important one, which is, how can prostate cancer present? I mentioned it's usually a silent presentation, just identified by a laboratory screening test, the PSA test. But we do see, I see patients with prostate cancer every week, and we do see patients who unfortunately present with urinary symptoms. That's what was released in the statement by his personal office. He had obstructive urinary symptoms. That's one. Number two can be pain in the back or other areas of the bone, unintentional weight loss, blood in the urine. So these are unfortunately signs of more advanced disease, and that's the information that we have for him. And that is fortunately less common. Usually we catch this much earlier and we can treat it effectively. So again, it's hard to know exactly what happened in his case, but a very small percentage of men will actually present with symptoms like this and present with metastatic or disease outside of the prostate.
As far as the Gleason score of 9, it goes 1 to 10. 9 is about as bad as it gets, correct?
Yes, sir. Yeah, it's a little confusing, and the Gleason score is a historic grading that we use for cancer of the prostate. So basically, for your listeners, we take a biopsy sample of the prostate, we look at it under the microscope, and we give it a Gleason score. So it's confusing because it's 6, 7, 8, 9, 10. So you mentioned, 9 is aggressive. That is about as bad as it gets. So there's another classification, a newer one called gray group, 1, 2, 3, 4, 5. So it gets confusing, but historically you'll see Gleason score used. That's what we commonly share with patients. And Gleason 9, I would think of this on a scale of 6 to 10. He's 9 on that scale, which represents a more aggressive form of prostate cancer.
Dr. Stephen Kappa, urology group here in Cincinnati. Lastly, as far as a man, let's say a man like yours truly, sees once a year, I go to the urology group. I have relatively low PSAs, below 4. I have that digital rectal exam, which is, shall we say, disconcerting. I tell Dr. Eric Kuhn, while you're up there, you got 10 seconds, enjoy yourself, but I don't want any more. What at risk is a guy that low PSA, but say below 4, and DREs are negative? How much risk is yours truly at?
No, I think you're doing all the right things. I appreciate you sharing that personal message with the audience. Here's kind of the bottom line, what I would advise men who are listening to this program. 1 in 8 men get diagnosed with prostate cancer in their lifetime. And, I think about this. This is your lifetime risk of prostate cancer is more than the likelihood of your car breaking down this year. And everybody gets their oil changed, their car checked, all the maintenance done on their car, but a lot of guys won't come in to see their doctor.
Right.
So you mentioned the things that you got to do. Start at age 40 to 45 if you're higher risk, 50 at the latest for all men. You get your PSA done. The exam has an important role as well, but I wouldn't let that scare guys off. It's really not that big of a deal to get done. But at a minimum, we want that blood test, the PSA. We want to individualize, personalize your care to your own risk factors. So that's what happens on that discussion. And I have this discussion again every day with men. It's about the risks and the benefits of screening and treatments and we walk through that journey with you. For your case, it sounds like you're doing all the right things. You're getting your checks. You're having that discussion with your doctor every year. And so I would just encourage all guys to do that. You get your oil changed. You don't hesitate that. You have a lower risk of your car breaking down than you do of getting prostate cancer in your lifetime. So definitely, I think that this story really highlights, it's an unfortunate story, and we hope the former president does well. But, what I would say is this can be a wake-up call for all the guys listening. Don't ignore those symptoms. Like if you have those obstructive urinary symptoms, you have blood in your urine, if you haven't seen your doctor in a long period of time, start that conversation today. Make that appointment today, because it can really save your lives, and you can be around healthier and longer for your family.
Is it possible that ex-President Joe Biden had low PSA and had digital rectal exams on a regular basis? He's an at-risk patient, not just the president, but at risk for all the cancers that he's had. Is it possible this thing developed after January the 20th of this year? Now, he was the president like 4 months ago. He got the awesome power. And is it possible all these things developed in the last 120 days?
Yeah, again, it's really hard for me to speperate on that because I don't have access to the medical record.
But
I know you want me. No, I understand the question very well, and it's so hard. I mean, the question is do we see patients who come in for the first time who have an advanced diagnosis that they didn't know about, or they may have had recent onset of symptoms? Could they have a fast-growing cancer that's aggressive? Yes. Do we see patients who have low PSAs, who have, unfortunately, aggressive forms of prostate cancer, other types of, we call them histologic subtypes, but, different forms of it? Yes. Are these rare? Yes. Again, real hard to speculate in this individual case, but, what I would say is, this case really highlights the importance of early screening, early intervention, because you don't want to come in with obstructive symptoms and a prostate nodule and a really high PSA, a really high Gleason score, and spread of disease to your bones. Some men will experience pain in their bones. It's really a difficult quality of life concern. And so, I would just, again, emphasize the importance of, you want to catch it early. Early screening saves lives, and prostate cancer is the most common cancer for men. Really, hopefully, a wake-up call to all your listeners. Get in, get checked.
Well, there's no guarantees in life. You get guarantees from Midas Muffler, and that's about it. But assuming you have a low PSA, you have digital rectal exams, you still can catch it, but you catch it early. On the other hand, you can have no PSAs and no digital, and you're fine, good to go. So the fact you have a low PSA and nothing on the DREs, the only way to determine if you have it or not is through a biopsy, and you don't want to go through that unless there's some other indicator. Is that true?
Yeah, absolutely. Yeah, I love the question because, what we do is we have other tools. We start with the screening, the risk factors, the family history, the PSA, the exam. But we have a lot of other tools. And what's been amazing about prostate cancer is we have new imaging tools. So MRI of the prostate, for example. We have other non-invasive tests that we can do to individualize your risk, genetic testing. There's a whole bunch of things that we employ to counsel patients, before they make that biopsy decision. We don't make that flippantly at all. And then, even beyond that, ways to image the entire body. There's a brand new PET scan. It's called a PSMA PET scan that allows us to better identify exactly where prostate cancer is. So it's been encouraging not just to see how we can better diagnose and manage patients, tell them about their risk, but also treat them. A rapid development of treatments over the last 5 to 10 years. So there really is a message of hope, too, not just early screening, but even if you do, unfortunately, get a prostate cancer diagnosis, there are excellent treatments available for you.
All right, but in his case, his age, et cetera, it's a difficulty. I like that. Wouldn't it be good in your profession to have Biden make clear his medical records the past 5 years to put at rest those who think I'm doing all the right stuff? If he did all the right stuff and this thing erupted after January the 20th, that'd be extremely unusual, but it's possible. It's possible. And the nodule could be the size of a grain of sand, or it could be the size of a pea. Is that correct?
Yeah, I mean, we do these exams, and again, it's uncommon that we find cancer this way on physical exam, but we do, and they can be small nodules. Usually, the prostate, I would think, it's smooth, and some men actually experience just enlargement, so they don't have cancer, but they just have an enlarged prostate. So it can be an informative test, but yeah, it can just be whenever you find a nodule, you definitely got to get a biopsy, and that's what sounds like happened in his case. And I think he shared with the public that cancer affects everybody. That's absolutely true. So, another thing is just in terms of prostate cancer prevention, I always emphasize the importance of healthy lifestyle. You're asking that, hey, I'm getting my PSA, I'm getting my exam, what else can I do? There are very basic things about nutrition and exercise and sleep, avoiding smoking, other substance use. There are basic things that you can do from a men's health perspective to optimize your health and do everything you can to stay healthy and happy for your family and to enjoy life.
Well, I'll come in again. I'm going to come in September to see Dr. Eric Kuhn. I'm going to tell him again about our conversation. Why don't you talk to him about the Great American? Tell him the Great American wants to come in earlier. Got me spooked a little bit here because I assume Biden got the best medical care in the world, and he got stage 4 metastatic cancer, and it spread to the bone. And I guess he's done everything possible, and it still happened. I need more facts. But Dr. Stephen Kappa, Urology Group, thanks for coming on the Bill Cunningham Show. We'll talk again soon. And, Doc, thank you very much.
No, I appreciate the time, and thank you very much for having me on.
And God bless America. Let's continue with more. I think it is absolutely incumbent upon Joe Biden to act responsibly and to relate precisely the number of times he's had PSA and DREs to give us an idea that there's a way of helping to diagnose this ahead of time, which is not going on, and we get nothing. I'd like to know more information, wouldn't you? Let's continue with more. Bill Cunningham, News Radio 700.